Hello, my name is Dr. Matt Kearney. I'm a GP and I'm Programme Director at UCLPartners.
Hello, my name's Laura Boyd and I'm Deputy Programme Director at UCLPartners.
So COVID-19 has placed unprecedented pressure on our health system, as we know, diverting our resources and forcing changes in the way we deliver care. Disruption to routine care in long-term conditions may worsen outcomes for patients, increase their COVID risk, and result in exacerbations that further increase pressure on the NHS over the coming months, driving demand for unscheduled care in GP practices and hospitals. So as primary care transforms its models of care in response to the pandemic, UCLPartners has developed some real-world frameworks to support proactive care in long-term conditions in this new world. So looking at the next slide, the core principles of the frameworks that they're all built on is firstly that they should be virtual by default. Secondly, that we should deploy the wider workforce to deliver significant elements of care. Thirdly, that we should get a step change in support for self-management. And fourthly, that we should underpin this with digital and other technologies to support self-management and remote management. The next slide, please. These are the conditions that the frameworks cover. So the 4 CVD prevention conditions: AF, blood pressure, cholesterol, and type 2 diabetes, and then asthma and COPD. The next slide shows the broad approach that we've taken in developing these frameworks. So first of all, we have developed searches that stratify patients with long-term conditions using clinical criteria, but also social factors and ethnicity. And that allows us to do a couple of things. Firstly, it helps us to prioritize patients in these really busy and demanding times. Who are the patients who are at high risk, who we do need to see soon if they're not to deteriorate and exacerbate? And who are the patients that we can safely phase their review to later months and know that we don't have to worry about them from a clinical perspective? But the other thing that this stratification approach helps us to do is to identify the care that can be delivered by other healthcare workers, healthcare assistants, social prescribers, nursing associates, etc. And it allows us to align the work to the workforce. And so healthcare assistants and other workers can support patients in education, self-management, and lifestyle change, all critical components of good proactive care in long-term conditions. And the next slide, please. So each of the frameworks consists of 5 elements. We've developed comprehensive search tools built for EMIS and System 1 that risk stratify the patients. Secondly, pathways that are not blueprints, but they're pathways for local adaptation. And these prioritize patients for follow-up, support remote delivery of care, and clarify what elements of care can be delivered by the wider workforce. We've developed scripts and protocols and training packages for this wider workforce to deliver their education, self-management support, and brief interventions. And we've identified a number of digital and other resources to support this care. And the next slide. So this slide shows the broad approach that we've taken to the cardiovascular condition. So you see the central line there identifies the conditions that we stratify. So for each condition, we have a separate slide set, and these show how care is prioritized in these patients. At the top there, you see once we've stratified the patients, the slide identifies what care can be provided by the healthcare assistants, social prescribers, link workers, etc. And these comprise 3 elements. So first of all, they can gather information that will then help the clinician getting up-to-date bloods, checking what the patient's blood pressure or weight is at home, their smoking status, and running risk scores such as Q-risk, CHA2DS2-VASc, and HAS-BLED. Secondly, they provide support for self-management with education about the condition, help with self-care, identifying red flags, teaching people how to do blood pressure correctly, how to check their feet for diabetes complications, and also to signpost to shared decision-making resources, for example, in relation to statins or anticoagulants. And the third element is to support patients in behaviour change with brief interventions and signposting for smoking, etc. At the bottom, we've identified a broad aid memoir of what clinicians would do to optimise therapy, reviewing results, reviewing complications and comorbidities, and optimising therapies. And the next slide, please. And this shows broadly the same approach to asthma and COPD, a similar stratification in the center, and then into priority groups, and then at the top identifying what the wider workforce would do to support education, self-management and lifestyle change, and critically to reduce work for the prescribing clinician, while at the same time improving the personalized care offered to patients. And the next slide, please. And I'll hand over to you, Laura.
So this approach has been tested with patients and members of the public to gauge their acceptance of the frameworks. And three key themes have emerged as a result of this. One is around communication. So patients told us that they were concerned about hearing from someone that they didn't routinely hear from in primary care, so someone who wasn't their normal GP and practice nurse. But they would be happy to hear from people who were consistent and confident in their messaging and had access to their existing health information. The second theme was around wanting to be able to have a conversation about their wider health and well-being, and not just having a conversation focused on the specific long-term condition that the person was contacting them about. And then the final theme, which will come as no surprise, is that trust element. So how could the patient and their carer be assured that the person contacting them was as they say they were, and how were they going to use the information that was being discussed? And we tried to incorporate these themes into the tools and the support that is being provided through these frameworks. This slide just lists the clinical team at UCLPartners who've developed these frameworks, so to provide that reassurance that this has been entirely clinically led. Now, in addition to the kind of the frameworks and what care can be delivered and by who, we've worked to develop an implementation toolkit that sits alongside those frameworks. So this comprises kind of three main areas, and it's all underpinned by implementation and clinical support by our team at UCLPartners. So first are those search and stratification tools. So they're all freely available via the UCLPartners website. And there are pre-recorded webinars to help you to deploy those search tools, along with FAQs if there are any concerns or worries. The second main area is around the workforce training and support. So as Matt outlined, we've identified the wider roles within primary care who can support the delivery and management of care. And aware that for some people, this might be a new way of working, we've developed a complementary workforce training package that sits alongside it. So the first is around that delivery, the kind of the communication with the patient. Our team have developed protocols or wording that can be used to contact patients, both for those low risk patients, but also for the other risk categories where the management and well-being of patients can take place by healthcare assistants and or others. And we are working with Care City, an organisation in North East London, to help train healthcare assistants and others both use those protocols, but also feel confident in health coaching and motivational interviewing techniques to have a really positive communication and consultation with patients. On our website, you'll find lots of practical training tools and links to websites from accredited providers of information, ranging from the British Heart Foundation in terms of how to use a blood pressure device, to links to accredited courses on how to deliver very brief advice for smoking cessation. And that's all really there to complement and support healthcare professionals working in primary care to be able to help patients manage their condition and stay well at home. And then finally, we're working with the local training hubs across North Central and North East London to provide specialist briefings on each of the long-term conditions that Matt outlined earlier. And our clinical team have produced a kind of a cheat sheet of the main topics that should be covered within that training for other areas who are keen to utilise that. As Matt outlined, we have identified many of those digital resources, those websites, apps that can support self-management at home. And we're working to provide additional workforce training so that staff can feel confident in being able to demonstrate and utilise those tools. Now, of course, none of this happens in isolation, and we do have a project and implementation team with a large clinical team at UCLPartners to support local practices and primary care networks to turn this into a reality. The frameworks have been overwhelmingly positively received across the country to date. We've had more than 2,425 requests for those search and stratification tools from all over the country. And many of these requests have also utilise the training and digital tools that sit alongside it. This slide gives a summary of how different academic health science networks are supporting their local areas to implement the frameworks. That's the end of these slides. If you would like any more information, please do contact us using the email addresses listed. Thank you.